I was one of those physicians that would see a lot of people a day and would take my work home, and I would be on vacation with my family at the pool, and I would be in the hotel room trying to catch up on my dictation. Good morning.
Good morning.
How are you? Now I'm able to enjoy podiatry a lot more as opposed to getting caught up in the paperwork component.
My specialty is diabetic limb salvage, so we do see a lot of people we see weekly. We see them with large wounds, and the nice thing is that basically patient comes in, nurse does sizing, pictures, we take those, enter that into the chart.
Diabetic patients obviously have a lot more needs, a lot more complicated type of treatment plans. There's a lot of different types of images that are available within the EMR program, and there's also the availability to import those images.
On the clinical summary screen, that is a very easy place to go back and look at previous visits to be able to track the wound measurement changes.
Once I realized I could customize it to see specific things across the top part of my screen, we use it all the time. I find that there are certain things that I, from a billing standpoint, want and need to see. And my staff who doesn't deal with that, there are certain things that they need to see.
I use the clinical summary to give me an idea of whether or not the patient's changing. That helps in my evaluation progress, whether the patient's doing well, they're doing the same, or whether or not they're deteriorating.
But you can go back and look at what you did in the past. You can follow your measurements and see what's working, what's not working, and adjust as you go through the patient's care.
And you'll get different pop-ups that will show up in your note there too that you should be addressing. It helps you not forget that you should be checking their hemoglobin A1C. It helps you not forget that whether or not they should be following up with their endocrinologist. Those kinds of pop-ups are important.
Entering our chief complaints, scanning in the notes is very useful, very friendly. Everything, all the information that we need is just all in one section.
If you've ever been audited, you want to be able to know whether or not you're doing the right thing. If you know that you're coding correctly, that gives you confidence to be able to bill correctly. I know a lot of people that have a note that supports a 213, but they're afraid to bill for it. So it will scan your notes and do your correct coding initiative for you.
It's funny that messaging has become so common in our world. We use the messaging for almost everything.
The message center has definitely helped us get a faster response. Instead of writing the message, leaving it on the doctor's desk, we're getting immediate answers.
We have 2 sites, and so not all of us are at each site every day. So it's an easy way to be able to communicate between all of the employees.
You did good. We went with Cerner for a lot of reasons. Cerner's been unlike any other EMR company that's out there.